Hello, I am Kasia Griffiths, biological dentist from Dental DNA, which is sponsored by Smile Dental Studio. Today, I'm pleased to introduce my guest, Dr. Lechner, a global leader in integrative dentistry. As a quick background, Dr. Lechner studied dentistry in Munich, and since 1980, he has been the head of Clinic for Integrative Dentistry, which is also in Munich. He is the PhD naturopath and a member of several scientific dental societies. My guest has published 11 books, 7 scientific papers, written over 90 articles, and I had found time to present over 80 education seminars in 8 countries all over the world, including US, China, Europe, not yet in Poland, but I hope this is gonna change soon. Apart from the scientific world, Dr. Lechner is a practicing clinician and a founder of International College of Maxillomandibular Osteoimmunology. But it wouldn't be the full introduction if I didn't mention that Dr. Lechner has also developed 2 patented diagnostic tools for integrative and complementary dentistry. Welcome, Dr. Lechner.
Welcome, Katarzyna.
Dr. Lechner, I would like to discuss a little more of your background. After you finished dentistry in the Munich Dental University, and like any other student, after years of studying, you started practicing as a general practitioner, isn't it?
Yes.
General, okay. Could you please tell me, was there eureka moment that compelled you to move into integrative dentistry, or was that a gradual process? And also, if you take some moment to explain exactly what integrative dentistry is.
Yeah, well, of course, I had my awakening moment when I was a dental assistant surgeon, and I took out a wisdom tooth, and next day a patient came. This was 45 years ago, and next day a patient came and said, "Oh, doctor, my heart arrhythmia is gone. My heart feels fine." And so this was this awakening moment where I thought, oh my God, dentistry possibly means to get positive medical effects beyond just making crowns and fillings. And so step by step, I went forward on this lane. And at the end now, I think we all should take care of a so-called integrative oral medicine, because it's so many chronic toxic, possibly, and chronic inflammatory reactions we dentists provoke inside the body. And the material, what you need, what you use for your crowns and bridges, of course, it interferes with your immune system. It interferes with your allergic system. And again, all those tricks we dentists learn and do, like root fillings, to keep the teeth as a mechanical tool, which is just nice. But possibly, the body is recognizing this as a dead part of his organism.
That's right.
And so it's hard to combine something dead with something living on the other side.
Very, very true, Dr. Lechner. A lot of patients, if asked what do you believe is the value of a dental checkup, would likely say it is to check teeth against dental decay. Would you agree that being a dentist, especially integrative dentist, puts us in a very unique medical position, that patients sometimes sees us more frequently than any other medical provider, and it's practically our duty to screen and diagnose our patients in terms of prevention from many other diseases?
Yes, this is a very good question, and you are absolutely right. As there is no organ inside the body where so early a doctor, a dentist, makes a filling. That means he tries to integrate some filling material, whatever it is, into the child's body. there is no organ which suffers so much from surgery, dental surgery, taking out wisdom teeth, taking out infected baby teeth, for instance. Yeah. The first contact to a doctor is probably to a dentist. Especially
when we say to the patient, see you after 6 months, which is rarely that any other specialist will see the patients after 6 months. It's usually they go there when there's something wrong or they feel wrong, or they are admitted to different specialists. But the dentists usually say, come for checkup every 6 months. So we see the difference in the mouth, what is happening.
Yeah, of course, to prevent the dental decay is, of course, it's very important.
Yeah, but we also see, as the mouth is the gate to the body, we also see how it's changing. Once we know the patient, we see what is changing in the mouth, whether the gums are inflamed, why they're inflamed. We also ask, how is he feeling? Okay, if anything changed since the last we met. So we gain the information about the patient, and we see the mouth, as, like I said, as a gate to the body. So we see everything what's going on inside, not only the teeth.
Yeah, but this is the point. We dentists should ask, how are you feeling? Yes. So in our clinic, the first question is not, where are your problems inside the teeth?
Yeah,
teeth.
That's right.
The first question is, what is your basic problem? What is your basic disease? What are you suffering from?
That is right.
And then when we know, oh, this patient has allergies, this patient has tumors, this patient has rheumatic diseases, yeah, then we try to find out where possibly is the origin of this disease inside the oral cavity. Is it material? Is it chronic inflammatory? Is it chronic toxic?
That's right.
And then we can really help the patient. Why is this necessary? This is necessary as all these infectious diseases, like tuberculosis, where our ancestors all suffered from, they are gone. Medicine is fantastic, yeah. But where is medicine failing? Medicine is failing in all these chronic inflammatory diseases.
That's right. That is right.
This is the problem. Yeah, it's multiple sclerosis. It's amyotrophic lateral sclerosis, it's tumors, it's rheumatic diseases, and so on, and so on, and so on.
But do you think this is a problem because the dentistry was separated from general medicine, and that leads some people to believe that our mouth is not as important as the rest of the body, that people watching all those changes in the smiles, they consider smile only as aesthetic thing, and they don't believe it can be a focal point for infection? Don't you think that people think this is this invisible line which is separating the head from the rest of the body? So when we can smile, then the rest is okay.
Yeah, this was a disastrous development in the 50s or in the early 60s. Where universities said, oh my God, we have wonderful organs here just below the shoulder. Above, this is teeth, this should look nice, but it's not connected to the rest of the body.
That's right.
This was a fatal decision. And this is what we both try to do. We try to change the dentist's and the doctor's mind that there is a wonderful and intensive connection from upside to downside.
That is right. And also that the organs, if they suffer from anything, it can show up in the mouth. So we may be the first doctor which is actually seeing patients' problems, not only starting in the mouth. This is the main thing which trying to talk about. And I know you had a lot of lectures around the world saying it. And
yeah, the problem is, where is the connection of teeth, oral cavity, jawbone to other organs? But I'm very happy that about 15 years ago, we had in our clinic the idea to check jawbone for inflammatory mediators. And I think this was the turning point, because what we found is amazingly, and now we have more than 3,000 of these findings documented, that bad or sick jawbone, which comes from wisdom tooth surgeries, from tooth extractions, which is growing underneath root fillings or around bad implants, that this bone is expressing a certain inflammatory mediator.
That's right.
And what are mediators inside the body? They are very, very important. And I explain it to my patients. Mediators, you all know, are the hormones.
Yeah.
Hormones are signals which are produced up there, and the effect is more in the lower body. And the same is with rantis. Rantis is an inflammatory signal which consistently is sending out the message, get inflamed, get inflamed, get inflamed. And it's not an acute inflammation. It's a very chronic process in slow steps. This signal goes to other organs and tells them, get inflamed, get inflamed. And if your, or whether your prostate or your breast or your brain or your liver gets inflamed from this signal, depends on your DNA.
That is right.
And now we have a wonderful connection. rantis is, of course, accepted by medical science. It is a medical proven signal. Nobody can say this is rubbish, this is something esoteric or whatever. And now we have this connection from here to all over the body.
I can see, Dr. Lechner, that osteoimmunology is your passion.
Yes.
And you recently published a phenomenal book. This is a must for everyone, all those described cases in details. Am I right in thinking that with this book you have set off to prove without any doubt the connection between chronic inflammation in the mouth and serious systemic illness? Would you say this is a must book for any integrative practitioner?
Yes, it's really a master book, especially when we focus the connection to overall health, from jawbone to overall health, when we focus on the jawbone. And why is this my passion? This is my passion on one side because I know for 40 years now that we really can help people. And I know that this is really a widespread phenomenon inside the jawbone. And the other point is, I want to convince doctors not to rely for 100% on their X-ray machines.
That's right.
Because in case these cavitational, thank you for the book, these cavitational phenomenons and this really dramatic pathology would be visible on the X-rays, it would not be necessary for me to write books on that. All universities over the world would teach their dental students on this cavitational osteonecrosis. But now, as they still believe on the X-rays and they say these cavitations don't show on X-rays, then this whole topic is forgotten, is neglected. And when we neglect this inflammatory connections from jawbone to organs, we really oversee and we hinder ourselves to help many people with systemic immune diseases.
That's right. As I have mentioned earlier, you developed these diagnostic tools, one of which is the CaviTAU, but we will go back to it because that's a very, very important topic. I think it's changing completely the look upon inflammation, the quiet inflammation, which we don't see on x-rays. But I have one more question. I believe there was in Bled, one of your lectures, you mentioned a girl, 18-year-old girl, I think, if I remember well. She developed epilepsy after her wisdom teeth were removed. Could you tell exactly what happened?
Thank you for reminding me on this case. But we already published this case in a scientific journal. And in short words, this lady was 19 years old. She lost her consciousness about 5 to 7 times per day, and just fell down, and 5 minutes later she woke up again and stood up. So for 1 year in a university clinic, they checked her for epilepsy, couldn't find epilepsy, just released her after 1 year of treatment with psychopharmacological medicine, with hormones, with everything, all without any effect. They released her with a recommendation for psychological treatment. It was very simple. This consciousness, a loss of consciousness, came up after they removed her wisdom teeth, all 4 in one session. And followingly, the wound healing was not properly. It was too much for this young body to heal these cavitations where the wisdom teeth were, to heal them properly. So from these areas, we had a consistent signaling through this Ranti's expression. And when you check for Ranti's and central nervous system in Google Scholar, for instance, you find hundreds of scientific papers which just build up a connection from Ranti's expression to inflammation into the central nervous system. And this is well known because astrocytes in the brain are most sensitive, the cells, most sensitive cells inside the body to Ranti's inflammatory signals. So she got a slight inflammation inside her central nervous system. Eliminating this Ranti's signal by cleaning out step by step, one after the other, of these wisdom teeth areas, we diminished and eliminated the Ranti's signaling, and she is cured up to date. And this case was, I think, 8 years ago.
Oh,
and we are still getting Thanksgiving letters from her.
Yeah, it's like life-saving, isn't it?
This is a wonderful case, where I want to emphasize, we are not doing wonders. This is not a wonder.
That's right.
This is just a wonder when you neglect these chronic inflammatory connections from bad wound healing in jawbone to other organs.
So, Dr. Lechner, when the patient is coming to your clinic, you do the questionnaire. Obviously, you're finding out about the chronic diseases, and then is what? You're doing an X-ray, and you know I'm going towards this CaviTAU now. I would like to find out why would you suggest to have CaviTAU? Why in the age when every dental practice got those massive machine of CBCT and taking x-rays and saying, no, there is nothing here, there is nothing I can see. Now you have this lovely, helpful tool, which is CaviTAU. And I would like you to tell us all about this. Why CaviTAU? Why it has to be a tool of an integrative dental practice?
Yeah, it's a good question. Of course, we do not say that CaviTAU ultrasound is replacing X-rays. We are doing all sorts of X-rays, including high-tech CBCTs, of course. But the problem is that most dentists don't see these cavitations on X-rays. I discussed this question just before. So measuring the bone density by our ultrasound device, CaviTAU, it's called CaviTAU because it's cavitations, which we are trying to display properly. And tau means transalveolar ultrasonography. Why transalveolar ultrasonography? Because we have to use a completely different ultrasound technique, just different to those the gynecologists do for the babies.
Mm-hmm.
Because this reflection ultrasound, the babies are shown, doesn't work in jawbone. The cortical part of the jawbone will immediately reflect this ultrasound wave. But we want to get an insight into the jawbone, inside the medullary space. Because inside the medullary space, the inflammatory processes which produce rhinitis are taking place. And so our routine is making an two-dimensional OPG to get an overview. Mm-hmm. Then we do the ultrasound. In case the ultrasound is positive, we do the CBCT. Why? Well, in each developed country here in Europe and even outside, we have a so-called radiation protection laws. And especially dentists do a lot of X-rays. And by using the CaviTAU before we do the CBCT with very strong and high ionizing strain, we get our necessary medical indication to do the X-ray after the ultrasound. Because ultrasound CaviTAU, everybody knows from babies, is absolutely harmless. And so doing the CaviTAU, we have two wonderful effects. We see what X-rays don't show, cavitations, and we protect our inner environment from increasing radiation. Because science knows even slow radiation, then they sum up to eventually disastrous doses.
That is amazing, actually, that we can have a tool like this now. And we not only protecting our patients, but we're also protecting ourselves.
Yes.
From irradiation. And one final question. Could you tell us a little bit more about the International College of Maxillomandibular Osteoimmunology?
Yeah, thank you. I like to do that because realizing my idea was realizing all these chronic inflammatory processes with disastrous connections to the patient's overall health. I thought we have to build up a group of therapists who focus their dental orientation, their dental work on these cavitations, on these maxillomandibular osteoimmunology. The term osteoimmunology is not from me. Osteoimmunology means that science is discovering that the bone, our skeleton, is not just to hang on muscles and tendons. The skeleton, especially the medullary space of the skeleton, is of crucial importance for our immune system. The medullary space of our bones is creating all erythrocytes, all lymphocytes, all leukocytes, and so on. So it's really, really important. And inside the medullary space of the jawbone, maxillary and mandibulary, we have a lot of these infections which destroy more or less, let's say, the birthplace of our immune system. And this is very important because up to now, the medullary inflammation inside the jawbone is not in the mindset of oncologists, of immunologists, and of other doctors.
That is very true. So who is the college directed towards, and where can we find more information about this?
Yeah, the main information you get on the website of CaviTAU. This is www.CaviTAU, like cavitations and tau, CaviTAU.de. There you find, you also find a map where we have these CaviTAU machines in use all over Europe. And we have even one in Poland. And so who might be interested as a patient, it's easy to get in contact with these dentists, with these doctors.
Okay.
And on this web page, of course, you get a lot of information. In case you are a dentist or a doctor, then this International College of Maxillomandibular Osteoimmunology is open for you. The abbreviation is ICOSIM or ICOSIM.
Yeah.
And each dentist is welcome as a member. It's 100 euros per year. And on this web page, first you find all my papers, all my publications on this topic, on this subject. And second, you are welcome to discuss your questions on this website and on this platform where we can discuss.
So simply saying it's open for all the dentists which would like to practice the integrative dentistry.
Yes.
Okay. Is this also open for doctors like rheumatologists, cardiologists?
Oh, yes. All these doctors are very welcome, because for us, we love to create a new term, and it's called integrative oral medicine.
Right.
Integrative means we are not outside the medicine. We want to be inside the medicine. And we want to create the idea that dental work, dentists, can be an important part of medicine. We are not just repairing teeth. We want to create all over health.
So, Dr. Lechner, we have to wipe off this invisible line separating our head from the rest of the body. Yeah. And you're doing a very, very good job in doing this. And,
this is a bad sign, you know.
Yes. And if anyone needs the website address again, it is www.icosim.de. And I will
thank you for spelling this.
Okay, I will put it in the end of our interview, so anyone who is interested or who is even wishing to get involved in this, because it can be a new route in the practicing dentistry, it will help to integrate with all of us. And Dr. Lechner, thank you so much for accepting my invitation to this interview.
Yeah, thank you.
And for taking the time to share your vast knowledge with us. I hope if you have time, you will come back and visit us again at the Dental DNA, which is a new magazine talking about the connection with the mouth and the rest of the body.
Yes, and I would like to come to Poland. Poland is not so far away.
Yes, right.
As the US, where I have to fly next week.
Next week, that's right.
And thank you very much to you. And I hope we are building up good connections for the profit of our patients.
Yes, thank you very much. And as a reminder, December issue of Dental DNA magazine will be discussing the chronic mouth inflammation and connected with systemic diseases, where Dr. Lechner will be sharing more of his knowledge about the dermatitis in connection with chronic mouth inflammation. Is that right? So thank you for your time again, and hopefully see you soon in Poland.
Thank you.
Thank
Bye-bye.
you. Bye.